Back to you, Chet.
Well, I think immediately for me, you just have to go back and look at the last century. Public health as a profession added 25 years to the average American's lifespan.
We directly touch everybody in the city, whether they know it or not, and we provide that invisible blanket of protection. But I'm most proud of, I think, of our relationships we have moving, like with Jordan Valley, how we've moved some of our primary care services to them because they could do it better, more efficiently, and see more people in Greene County than we could. And it freed up money for us to concentrate on more important things on the preventative nature, like chronic disease prevention, as well as high-risk prenatal case management. I think made a world of difference in how we do business at the health department. Well, in Springfield, it's vitally important. I mean, we have two very large healthcare systems. We have a very vital connection with our community health center. We've got many people working in the community, and I think we're the kind of the key to help move these people in the right direction all at the same time. I could not be prouder with the relationship we've had, and it's because of years of leadership, not only by who's here now, but in previous years, and the trust that our community has in our ability to work together to try to meet the common goal.
You know, we've talked a lot locally, and especially lately, about the local public health system. That acknowledgement that we're much more than just a local public health department. We're a sum of many parts. And it's those partnerships with agencies and institutions that are going to make us stronger as a community.
A lot of what we've done with communicable disease and our preventative health services, even though it goes pretty much unnoticed, I would put our communicable disease program, our EPI program, against any in the country. We made it a priority, and I think we've saved a lot of lives throughout the years because of that responsiveness. And I think third is we made sanitation and clean and wholesome food a priority. We make sure we have well-trained sanitarians that are out there in the field all the time.
And just take a look at our WIC program. I think that's a model of success for the state. Largest in the state. Big is not always better, but in this case I think you can argue that it is, because we afford opportunities the smaller health departments can't. We have a lot more appointments available in a lot more locations than many other entities have that, you know, the capacity to do. Add that to we are co-located with Jordan Valley Community Health Center. You can't take for granted that FQHC and a health department are always going to have a good relationship. I think we're somewhat unique in that regard. And think about all of the opportunities that these moms and babies have by being co-located with a big provider of health care. I think that's a wonderful model and a great success story that's still in the making.
And to be successful, you have to keep focused. And the reason we get along so well with our partners in our community health centers is the patient is always the number one focus. We don't have to get all the credit. We don't have to get all the money. We don't have to perform all those activities. But if you're always focused on the patient and the health of that patient, then we're all winners in this situation. And that's why I pride our department on.